My name is Elena Falokas, and this is MUW-NU 361 class. And today we are doing patient teaching. This is my patient, Lacey. Lacey, do you consent for me to video you and upload it?
Yes.
Okay, perfect. Today we're going to be doing teaching on hypertension. What is hypertension? I'm going to give you this handout, and you can follow along, and you can take it home with you. And if you have any questions or concerns, we're going to go over all of it today. So in your chart, you're diagnosed with hypertension, and you have a huge family risk factor of it. So let's learn about it. Do you really know what hypertension is?
No.
Hypertension is high blood pressure. You may ask, what is blood pressure? And high blood pressure is basically when the heart is working too hard to push the blood through the arteries, and that force is damaging your artery and vessel walls, and it can possibly damage your organs if it occurs over a long period of time. So, do you know what a normal blood pressure is?
No.
Okay. The normal blood pressure is 120/80. The top number is your systolic, and that is when your heart is contracting and beating. The bottom number is your diastolic, and that is when your heart is relaxed. Hypertension is diagnosed when the systolic is 130 and the diastolic is greater than 80 over a long period of time. Okay? So, hypertension increases your risk of heart attacks, strokes, heart disease, and often people don't know they have it. Good thing for you, you know you have it, and you're taking medication in your chart to have it under control. Do you experience any symptoms when you notice your blood pressure is getting high?
No.
Okay. Well, it's often known as the silent killer. Most people don't realize they have it until they come in and the provider checks their blood pressure and it's out the roof, and they don't know how long their blood pressure has been that high. So, some of the symptoms you can experience would be headache, shortness of breath, and nosebleeds. Have you experienced any of those?
Headaches.
Okay, that could be because your blood pressure was high at the time. Now, risk factors. These are some risk factors for anybody you want to tell about that is not diagnosed with hypertension, that you can warn them so maybe they can go get checked out at their primary healthcare provider. Age. People over 65 have an increased risk. Race is more common in African Americans. Family history. Obesity and overweight, lack of exercise, a high sodium diet, decreased potassium levels, stress, and pregnancy. How we diagnose it. I already told you a blood pressure reading greater than 130/80 on 2 separate occasions, and then there's different stages of high blood pressure depending on how high those numbers are. We can do blood pressure monitoring over 24 hours. Then you can see lab tests to see if the hypertension is related to other conditions. And then sometimes they might do an ECG or an EKG or echocardiogram to see how fast and hard the heart is pumping and seeing if it's like damaging anything inside the heart. And usually they want you to do, when you're diagnosed with hypertension, to do at-home blood pressure monitoring for over a course of a few weeks, periodically throughout the day. Treatment, you want a low salt diet, physical activity, maintaining a healthy weight, limit alcohol, no smoking, plenty of rest. Medications might include diuretics to get that fluid off, to decrease that pressure in those vessels, ACE inhibitors, ARBs, or calcium channel blockers. You're on a beta blocker, which also can be used for hypertension. Now, prevention and self-help. So, how are we going to prevent it when you go home, besides your medications? You're going to eat healthy foods such as fruits, vegetables, whole grains, poultry, fish, and low dairy foods. Less salt, no more than 1,500 milligrams a day. No smoking, limit to no drinking. Maintain a healthy weight, get good exercise. They recommend 150 minutes a week or at least 30 minutes a day, even if it's just walking to your mailbox a few times. A good night's sleep, around 7 to 9 hours. And I know that's hard with busy schedules, but try to make that a priority. And manage stress. Maybe do some like meditation or exercise even helps to manage stress. Did you know in 2023, high blood pressure was the primary cause of 664,470 deaths in the U.S.? So it's really important for you to come in for your yearly wellness visits and check that blood pressure with your provider and tell them about any problems you may be experiencing. And nearly half of adults who have high blood pressure are taking medication for high blood pressure. Only about 1 in 4 have their high blood pressure under control. And you would be one of those 4. High blood pressure is a serious issue that you need to take seriously. You need to tell all your family and friends that they need to be going to their wellness visits because it is the silent killer and you may not know you even have it. Do you have any questions today?
No, ma'am.
Okay. Well, take that handout home with you and call us if you have any questions. But thank you.